Hello, welcome my friend. For today's video, we are going to talk about ectopic pregnancy. We are going to talk about ectopic pregnancy. Without further ado, we are going to define what an ectopic pregnancy is. And an ectopic pregnancy is a type of pregnancy where implantation is outside the womb. It's a type of pregnancy where the baby forms outside the uterus. You are most welcome to our channel, Gerard Massa, the health educator, and on this channel we do talk about pregnancy, we do talk about the ovulation tips, and we do also discuss and answer all your questions. You are most welcome, and remember to subscribe so that you watch videos like these we release every day at exactly 17 hours. So without further ado, we are going to talk about ectopic pregnancy, and we have already defined an ectopic pregnancy, and we've said that it's a type of pregnancy where the baby forms outside the uterus. And specifically, we shall take an example of this diagram. You realize that this is the female reproductive system. We have the ovaries around here. They are two. They are held in place by a small muscle, and this is known as the suspensory ligament. It's a type of muscle which holds the ovaries in place. The next is the whole of this length is what we call the fallopian tube. These are the fallopian tubes, and then we are discussing ectopic pregnancy. Specifically, this is the V, and then this is the cervix. It has two parts. It has the internal part, also known as the internal os, and then it has the external part, known as the external os, or the external part of the cervix. What happens is that when fertilization takes place, we've talked about fertilization on this channel. If you missed our videos, please go back to our videos. In the video library, there are lots of videos talking about, we've put out lots of videos talking about ovulation. But in a nutshell, ovulation is specifically the release of a mature egg, also known as the Graafian follicle, on the 14th day. So when we have an ovary around here, and then it releases an egg on the 14th day, from the first day you saw your periods, we call that ovulation. So when the egg has been released, it stays for only 12 to 24 hours. Within 12 to 24 hours, fertilization is expected to take place. If fertilization does not take place, what happens to the egg after it has been released is that it disintegrates, or it disappears around this area, and actually pregnancy will not form. So in normal circumstances, when an egg has been released, either from the right side or from the left side, it does not matter. There are women who actually ovulate on the left side, and then there are women who ovulate on the right side. So when an egg has been released on the 14th day, and let's take an example that the egg has been released on the 14th day, the egg has been released on the right side. When it has been released, it stays around for 12 to 24 hours. And when it has been fertilized, it will travel through this whole distance, and basically it will travel through the fallopian tube, and then it will come up to around this area where it will implant. Now, implantation may take place on either sides. It can take place on this side or on this side, and then after implantation has taken place, there's going to be burrowing, or there's going to be digging. This egg or the embryo that has attached onto your womb, it will begin digging deep. And as it is digging deep, there are blood vessels around here. So as the embryo is digging deep, these blood vessels are going to rupture. And when they do rupture, they're going to cause some little or some slight bleeding, which may actually filter downwards up to your knicker, and then when you wake up in the morning, you will see some drops of blood on your knicker. This is what we call spotting or implantation bleeding. So we've defined, or we've described what happens in normal circumstances. Now we are going to look at what happens in ectopic pregnancy, and we shall also look at the various types of ectopic pregnancies. We are answering a question that was asked by one of our subscribers about ectopic pregnancy. She had an ectopic pregnancy and then she underwent operation where they opened up the tube and then healing was taking place, but she's still feeling pain. So we are going to discuss all that. By the end of this video, you will be understanding everything about ectopic pregnancy. Remember, you are most welcome to our channel, Gerard Massa, the health educator. If you are new here, I welcome you, my friend. Subscribe so that you do not miss any new videos. When you keep watching our videos, you will get pregnant. You should put your trust in God and follow what the experts tell you, and everything will be fine. So we've said that in normal circumstances, when the egg has been released, it will travel and then attach here, implant, and then growth will take place. But what happens, what if the egg or the embryo which has been fertilized does not travel through the fallopian tubes, and then implantation does not take place on your womb or on your endometrial stripe? That is what we call an ectopic pregnancy. An ectopic pregnancy will result. So we are saying that the fallopian tube in women, it measures between 7 centimeters up to 12 centimeters. This varies from woman to woman. It varies from woman to woman because of women have different pelvic width, or they have different sizes of their waist. So if a woman has a fallopian tube that is measuring 7 centimeters or 8 centimeters, there's no problem. It can still take through, the whole process of transporting the egg can happen. So thank you, my friend. We are proceeding with our lesson. We have said that there are different types of ectopic pregnancies, and we have said that when the ectopic pregnancy is in the ovary, the egg has been released, fertilized, and then it remains in the ovary, we call that an ovarian ectopic pregnancy. And then if it remains along this area, then we call that actually an interstitial or an isophymal type of ectopic pregnancy. And then remember, the fallopian tube has several parts. It has actually different parts. So we have this part. This part of the fallopian tube is also known as the interstitial part of the fallopian tube. Around here, this is known as the interstitial type of the fallopian tube. And then next is what we call the isophymal part of the fallopian tube. And then lastly, this tubular structure is what we call the infundibulum. It's round, it is actually large in size. So when an ectopic pregnancy forms, there's going to be signs. How will you tell that you have an ectopic pregnancy? So to tell that you have an ectopic pregnancy, there's going to be pain. First of all, you'll begin getting signs of pregnancy, but you are going to have lots of pain. There are women who have ectopic pregnancies and yet they do not show actually any signs. And then there are women who have ectopic pregnancies, and when you go and do the pregnancy test, it will show a positive sign. Then there are some women, actually a large number of women, who have ectopic pregnancies, but whenever they do the testing, whenever they do the urine pregnancy test, it shows negative. So it is very, very important to notice that, or to take note that if you are a woman and then you've missed your periods, basically you've been ovulating but you missed your periods and you have severe lower abdominal pain, which is right-sided or left-sided. Remember, we said that the ectopic pregnancy can happen on this part of your fallopian tube, or it can happen on this part. Given the fact that when you do ovulate from the right side, then it's most likely to form in this side of the fallopian tube. So the signs of ectopic pregnancy, there's going to be lower abdominal pain, there's going to be fainting, there's going to be dizziness, and then of course, if at all it's not managed, if at all you are not managed very fast, and then it may actually become what we call an obstetric or gynecological emergency, meaning it becomes an emergency and you need to be rushed into hospital very fast. So if you are a woman and you are having severe lower abdominal pain, which is right-sided, please, you should not sit and wait because it may worsen and then you can actually faint. So you need to go to hospital. Remember, when you have lower abdominal pain and you are a woman, it is not a conclusive diagnosis. It's not a conclusive, it's not a conclusion that you have an ectopic pregnancy. It may be a sign of something else. It may be a sign of probably a uterine fibroid. You may be having another condition which is like, for example, endometriosis, or it could be endometritis. Endometriosis is basically a condition whereby this part, it's actually known as the normal tissue of the uterus. Instead of growing along the uterus, it goes and it forms outside the uterus. When you have uterine tissue forming outside the uterus, then we call that endometriosis. And then when you have the inside of your uterus, that is the endometrium, having actually lots of fluid inside here, lots of free fluid inside here, then we call that endometritis. Endo means inside, and then metritis is inflammation of your inner womb. So when you have lower abdominal pain and you are a woman, please go to hospital. And when you reach hospital, your doctor is going to request for a pelvic ultrasound scan. Remember, we said that a pelvic ultrasound scan is an examination, or it is a test which is done in hospital where images of your womb can be taken. Images can be shown on a computer, and then from there, actually, those images can be interpreted by your doctor, who will actually give you the next plan. So, ectopic pregnancies can show on an ultrasound scan. Ectopic pregnancies can show on an ultrasound scan. Basically, when you do an ultrasound scan, there's going to be an appearance. Doctors call it a ring of fire. It's kind of, it is a round, it will show an ultrasound scan, something circular, and then something showing lots of vascularization or blood collecting in that area. Of course, with a gestational sac, that will be shown, and then management will be given for an ectopic pregnancy, where your doctor will put you on IV fluids. Then also, the management of the pain will be done by your doctor. But the most important thing to note is that ectopic pregnancy has to be treated in a hospital where there's a theater, whereby an operation will be done. And then, of course, the ruptured, or the site where the ectopic tube is, will be actually opened up, and then draining will be done, and then closure will be done, and then antibiotics or postoperative drugs will be given to you. Remember, you need to take those drugs for that specified period, the period your doctor told you, because if you do not take those drugs, then there are high chances that actually you may end up going into sepsis. You may end up getting infection at the site of operation. At this point, we answer a question which was asked by one of our friends. She had an ectopic pregnancy. Well, she did not specify which side was affected, either this side or this side, and she did not specify which type of ectopic pregnancy was it, whether it was an ovarian ectopic pregnancy, or it was an interstitial or epiphyseal, or it was an infundibular type of ectopic pregnancy. But she was asking that she's still getting pain. The answer to this is that either healing has not taken place, or the wound care was not really good. Probably maybe the dressing was not done well, or the diet. A person who has had an operation should have a diet high in proteins. Proteins quicken wound healing. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend. Remember to subscribe so that you do not miss any new videos. And connect with me on my website, gerardmassa.thehealtheducator.com, for a private chat, for a private consultation. I'm looking forward to talking with you. See you in my next video, and have yourself a fantastic and healthy day. Put God first and everything will work out. Bye-bye. See you.